If you're like many adults, most people take better care of their car than they do their own body. They'll take the car in, get the oil changed, tires rotated, and really think you've done something. But when it comes to your body, oftentimes that's an area of neglect. And so one of the most important things that you can do, and what this program is about today, is to have a primary care doctor. You need to have a quarterback that's there for you to help direct you in your health care needs and issues, and then for you to go in once a year and get a checkup, get your tires rotated, and make sure that everything is okay with you. Now, our first guest today is Dr. Michelle Allmon from Baptist Medical Group in Collierville. Welcome.
Thank you.
Now, today, one of the areas that we want to talk about with you is high blood pressure. What is high blood pressure?
So most people who have high blood pressure have primary hypertension, and the exact causes are not known, but there are a variety of risk factors that have been associated with it. And those include genetic factors. So if both of your parents have high blood pressure, you're at higher risk. The African American race, we see more severe hypertension in that race. It's also associated with excessive salt intake. Another thing is obesity and weight gain. And I see that every day in my practice. People who lose weight, their blood pressure gets better.
Now, what are some, or are there really any hallmark symptoms that somebody could have that make them think they have blood pressure, or as oftentimes high blood pressure is alluded to as the silent killer? Sometimes you don't have any symptoms at all, but are there any common symptoms that people should be aware of that could possibly be caused due to high blood pressure?
Right, so it's called the silent killer because it often doesn't cause symptoms until you develop a serious health problem from high blood pressure. So some of the acute symptoms that you might get from hypertension are headache, confusion, and these are serious life-threatening emergencies from it. But usually you don't have any symptoms, which is why it's important to know your blood pressure numbers.
Well, that's part of what we were talking about, having a primary care doctor and going in and getting a yearly physical, because oftentimes you may not even know you have high blood pressure till you go in and get a checkup. So once you come in, you get a checkup, and you discover that you do have high blood pressure, what are some of the next steps that you go through to treat that?
So if your blood pressure is consistently high, greater than 140/90, then your physician will recommend medication. But some environmental changes and lifestyle changes that you can do to improve your blood pressure are limiting alcohol intake, limiting salt intake. That includes also the DASH diet, which is dietary approaches to stop hypertension. And the basics there are you want to increase your intake of fruits and vegetables and dairy products in addition to lowering your salt intake. And then also lose weight if you're obese or overweight, increasing physical activity.
So there are a lot of things that you can do short of medicine to help your blood pressure as well.
Correct.
Now, BMG has an initiative right now called Measure Up, Pressure Down. Tell us about that.
So this is a national campaign that Baptist Medical Group has been a part of since 2013. And this spans over a 3-year time period. And what we're trying to do is educate our community about hypertension and try and get our patients blood pressure control. We want control of our blood pressure in 80% of our patients by the year 2016.
What do you think about some patients measuring their blood pressure at home, getting their own blood pressure machine or whatever? Do you ever recommend that or tell patients to check their blood pressure?
I do. That's very helpful, particularly when patients' blood pressure is high when they come into the physician's office, which often it is, and it's helpful to compare that with readings at home. It's also good for them to monitor their blood pressure at home when we're treating them so they can keep an eye on it.
And address this issue, because I see this a lot in our practice, that oftentimes people will get on blood pressure medicine and then they will, once their blood pressure's down, I don't need that anymore. How important is it that once you're on medicine that you're consistent with taking it?
All right, that's very important. And what I try to educate my patients on is take your blood pressure medicine, get it under control, make those lifestyle changes, and then as you know, if we're able to stop your medicine, we'll start to see your numbers come down. And that's when we know we can start decreasing the dose of your medicine, which does often happen.
Well, in the last few seconds, tell our viewers what's one of the most important things they can do when addressing high blood pressure.
Most important thing is make those lifestyle changes. Exercise, regular exercise, change your diet, and then lose weight, because it's highly associated with obesity.
Well, thank you so much for being here, Dr. Allmon.
Thank you.
And again, as she said, it is so important to not just depend on medicine alone, but also lifestyle changes. Now, our next segment here at Health Matters, we're going to talk about who are primary care doctors and how do you access primary care doctors. I'm Dr. Mark Castellaw with Health Matters.